Soft toric contact lenses. Next, we are going to study about soft toric contact lenses. Astigmatism. Astigmatism occurs when a cornea does not have a spherical surface. The two corneal surfaces produce two focal points in a back of the eye. Contact lens correction for astigmatism. Almost 45% to 50% of visual correction population having a significant amount is minus 0.75 diopter or more of astigmatism. There are essentially three ways astigmatism may be corrected with contact lenses. Which are they? Is rigid gas permeable lenses or RGP lenses, and spherical soft lenses and toric soft lenses. Next, what is toric lenses? Toric lenses is a lens used to correct astigmatism or cylindrical number as it containing cylindrical components which stand soft contact lenses do not have. Spherical or toric lenses. First diagram is given for spherical lenses and second is given as a toric lenses. Indication: visual compromise from residual astigmatism. Unsatisfied visual acuity is best sphere. High sphere to cylindrical ratio. RGB is not tolerant. Fitting for toric lenses. 3 fitting technique: diagnostic, trial and empirical. First one is toric lens stability and stabilization technique. A toric lens should remain stable and should not rotate in a eye to provide stable vision to the wearer. There are different methods and designed for stabilization: prism blast, traction, periblast, dynamic stabilization, double slap off, or combination of it. First one, toric soft contact lens measurement of a lens rotation. Rotation is measured by a laser marked which are at 3, 6 and 9 o'clock position. Rotation can be measured by narrow slit lamp beam, protector scale or a eyepiece of K, and last one is spectacle trial frame. Trial toric lens fitting. First time refraction and cylindrical is minus cylindrical form. Right eye is minus 3 minus 2.50 cylinder at 170 degree. Unlike the spherical lens, having no need to do a spherical equivalent. Do vertex distance compression of the spherical and cylindrical suppression. Toric lens fitting, we are doing its indicated that 2 cylindrical power is reduced to minus 2.25 to be declared. All toric lenses have base curve. And toric lens fitting for another one is base curve is determined by doing keratometry. Example 1.60 mm to 1.80 mm, adding 0.80 mm to flatter median or a highest reading in mm. In the above example is 7.80 mm is flatter and higher than 7.6. Toric lens fitting is 7.80 mm plus 0.80 mm. It's give 8.60 mm. The base curve of trial lens will be a 8.60 mm. Seventh step, you will be spherical cylindrical power as well as the base curve of the trial lenses is tried on a patient. Choose a trial lenses as close as possible to the spectacle cylindrical lenses. It lies in a 170 degree. Toric lens 9th step is supposed to a trial set. It's given the example. Trial lens fitting for minus 3 minus 1.75 at 180 degree. His base curve is 8.60 mm. Then this given the trial to the patient to wait 50 to 20 minutes before the assisting fitting of the lens. 11th step is assist to fit the lenses by full corneal curvature, centration, movement, comfort and stable vision. Toric lens fitting, it is not always possible to show vision to patient as trial lenses axis might be matched spectacle lenses. If first 4 factors are fine, then axis finalization is done. And toric lens fitting, the axis finalization is concentrated at the three laser guide marking at the inferior and lower portion of the lens. Toric axis finalization, three things can happen while assisting toric lens rotation. No rotation or minimal rotation of 5 degree rotation is LHS with reference of rotation of RHS. Thumb rule is LARS left add right subtract. Its lens rotation is 10 degree require minus 3 minus 1 at 10 degree. If we subtract is 180. If odd it's become the degree is 20. And toric axis finalization case 1, the rotation of minimal rotation is 5 degree is normal. No changes in spectacle lenses, hence the prescription is remain at the 3 and 1.25 cylinder at 170. Base curve is 8.560. And case 2, the rotation of LHS by 50 degree is normal and the 50 degree is spectacles, hence the prescription is added to 50 and 5 degree. 5 degree in given. And case 3 is RHS is giving a 10 degree is also given. And toric lens is fitting after a axis finalization, the final toric lenses is ordered and given to the manufacturer. And this is a good foot, tight foot, loose foot. How do we assess the soft contact lens, toric soft contact lens assessment? First one, good foot, full cornea coverage, good centration and movement, quickly return to the axis if mislocated. And tight fit, good centration, initially comfortable, little and no movement, slow return to the axis of mislocation. Loose fit is excessive movement, poor centration and comfort, and lens rotation unstable and inconvenient. This is just to be remembered, do not make any changes in the trial lenses axis. Trial lenses fitting is a very reasonable and scientific method to fit trial toric lenses. Choose trial lenses axis as close as possible to spectacle lenses. Things to remember: if trial lens axis spectacle axis are different, then do not attempt overcorrection as it can be lead to confusion. Final lens base curve should be same as trial lens base curve. Like the trial lenses, final lenses would also show similar rotation. Care and maintenance similar to standard soft contact lens multi-purpose solution, proper insertion and removal throughout the patients to avoid the lens damage. And while removing, the patient should be either pinch the lens for the slender and else essential to rotate the lens is either direction right or left to avoid lens damage along lens marking. And brand of toric lenses Alcon, Bosch and Loeb, Cooper Visions and JJ. The customers made soft toric are also available from a company of Flexwin and Pure Contact Sample. Thank you.